Thank you everyone for joining us this morning. I'm going to give everybody a chance to log on and we'll start the presentation here in a few minutes. All right, let's go ahead and get started today. Welcome everybody to the Frontiers Research and Discovery Grand Rounds. If you aren't already a Frontiers member, please visit the website on this slide and become a member to learn more about the resources and opportunities available through Frontiers. Our next slide is going to talk about the next Research and Discovery Grand Rounds. That'll be on Thursday, November 21st at the same time from 12 to 1. And we'll be talking about translational science versus translational research. What's the difference between the two? So that's what that presentation will be about. Please join that if you're interested. Um, I'm going to go ahead and get into some of the quick introductions for both myself and our presenter today. So my name is Hannah Hancock, and I'm the screening coordinator and recruiter for KUMC CTSU Wichita. I've been working in this role since May 2023. And in this role, I work with a variety of different PIs who are interested in either using the CTSU Wichita as a site for their clinical trials or using the Wichita team as their study staff. And my role specifically can range from coordinating different outreach efforts to source potential participants, and then I'll also work with those participants through the screening process. Our site also has research nurses, pharmacists, regulatory coordinators, clinical research coordinators, and our own investigators. So we're unique in that we can take on the role of the study team if that's needed for the study, or we can just provide a clinical space for an investigator if they've got their own study team they'd like to use. So if anyone's ever interested in getting involved with the Wichita CTSU, you can reach out to myself, or our manager is Shelby Williams. And we can help you get in touch with whoever is needed. My role in Frontiers specifically is I work as the Wichita navigator for the Network Capacity Core, and I work in that core with today's presenter, Hanlon Co. Hanlon is our Frontiers Recruitment and Network Capacity Manager. He's been in this role for just over 2 years, and he was previously working with the KU Cancer Center's Biospecimen Repository Core Facility and the Masonic Cancer Alliance. Part of his role with Frontiers involves helping connect our research community to different tools and resources that are made available from the Clinical and Translational Science Award. Before I turn it over to Hanlon, I just wanted to let everyone know that I'll be monitoring the chat today. So if you have any questions, please put them there, and then I'll relay those to Hanlon as he presents. Thank you, everyone. And Hanlon, please take it away.
Sure. Thanks, Hannah. Thanks for that lovely introduction. Thanks, everybody. Really happy and appreciative for the opportunity to kind of showcase some of the different resources and tools made available to us through our Clinical and Translational Science Award. As Hannah said, my name is Hanlon Kuo. I'm our Recruitment and Network Capacity Manager for our Network Capacity Core. And why don't we just get started? And obviously another plug here, just in case for the recording, there's a QR code here if you want to sign up to be a Frontiers member. Obviously, again, we really encourage it to get all the latest news, training opportunities, and funding opportunities. Okay, and kind of what we're going to go over here, the resources we have listed. So the first one will be our Trial Finder mobile app. Some of you may have heard it before, but it basically just acts as a trial directory, and we'll get more into how it works here in a second. The second is our accrual prediction app. This is a web-based app that you have to be on KUMC network to access at this time. But what it does is it kind of gives a broad overview of all of our studies enrollment metrics. So you can quickly and conveniently see how your different studies are enrolling. Our third resource will be it's called researchmatch.org. It is a website platform ran by Vanderbilt University, and it basically what it does is it matches interested volunteers with research studies, and we'll kind of show you how that works. And then our last resource, one we've given a research discovery grand rounds on before, is our expression of interest and multi-site consultation opportunities. These are made available through the Trial Innovation Network, which is a network made of all the other CTSA Hub awardees. And so I'll kind of go over what that is and how the two opportunities here work. So very pleased to go over these with everyone. Okay, so the Trial Finder mobile app. What is it? It's a free mobile application. You can actually download it on Android and iOS at this time. If you just search Frontiers Trial Finder, it should come up. But our why is that we felt like patients, community members, and even clinicians need a convenient way to view active clinical trials. I would say, when people, as we all know, clinic time and space moves very quickly. It's hard to kind of remember, especially if you're referring to another division or disease group type of trial. It's always hard to remember what's available at the current time. So we feel like there's a good space, a good gap here that we can fill in a need. And like I said, it can help with trial referrals from friends, family, or even community providers. Another aspect we see is that because the app sits in between our research community and the regional community, it can almost potentially be a communication tool. So we can connect other Frontiers research related news or other opportunities available that the community can engage with. So we kind of feel like there's a neat little side ability here with the app. Okay, so how does it work? Basically, the Trial Finder mobile app, it talks to our KUMC Chris Velos system, our clinical trial management system. Chris stands for Clinical Research Information System, and it's based off the Velos e-research software that we've partnered with. And so what it does is we build a data feed that extracts studies from our clinical trial management system. And so then in this data feed, we're able to display the extracted studies in almost in a variety of different ways. And the mobile app is just one way to display this feed. And so the way that studies are extracted from the clinical trial management system, we've added a study form that's available, that's selectable. It's if you're on the back end, it's called the CTSA All Flow Navigator study form. But when that form is filled out, it will pull that study and put it into that data feed, and then we can display that data feed or whatever studies we extracted to whatever menu or user interface that you want. And so what we've done is we've partnered with the Chris Velos team, and we've worked out a flow so that studies being added, the form being filled out, it's part of the Chris Velos team workflow now. So it's almost automated and streamlined in a way. And I'll show you here on the next slide a little more detail on how that works. So first, when we wanted to implement the app, obviously there were current active studies, right? That were already available. And so there was no future flow for those. So our retroactive way to add studies, I'm going to show you just a little insight here. So first, we needed to extract all the current studies. And so we don't want all the studies in the clinical trial management system. So we extracted only the current active ones, and that was provided from the Velos Chris team. And then we had to go through those lists, and to start building the data feed, we had to create categories. So I'll show you the trial directory in a second, but with most directories, there's some delineation and categorization of what you're trying to find. And so within Chris and Velos, Chris does not necessarily have the fields, that we want to align with how the data feed needs to be organized. And so the two categories we needed to create were disease group and type. And so basically, you would go to a disease group, look for your disease group there, and then within that disease group, you can find the specific disease type that you have for the trials you were looking for. So the way we determined these categories was that for disease group, we just took our divisions. So it's kind of nice. So like neurology, allergy, and rheumatology, all those Alzheimer's, all the divisions were just automatically determined to be the disease group. Now, with the disease type, there was no real field within CRIS that just says what disease type this is. So we did have to, network capacity team and the Velos CRIS team did go through all of the trials and determine what the disease type was. And, the Velos CRIS team, they're very familiar with going through studies. And so they feel like they're pretty confident on determining what the disease type is. And then obviously we have a feedback process to where investigators or managers feel like we incorrectly categorize their study, they can reach out to us and we can adjust that. So we sort the master list, and then when we add the categories to the study form, then when we activate that study form, so for instance, when we first created the CTSA all flows study form, there was no categories there yet. But as we determined them, we would have to submit a form change request to add whatever new disease groups or divisions we determined and disease types. So once those got added to the form, the Velos CRIS team can enter them. So what that means is they'll go into each study, they'll go to the forms tab, and they'll select our CTSA all flows navigator form. And within that form, it'll have the disease groups we categorized, and then within those disease groups, the disease types that we determined. So once the Velos CRIS team fills out or fills out what disease group is the category, and then they'll fill out disease type, then overnight the app will automatically pull from the data feed and update itself with the new study. So the app does update overnight every night. And so that is how we went through the retro process to add studies. And this is still continuously going. I think we're about just under 50% through, maybe over now, on getting all the retro studies added. And it's still an ongoing process. So the future flow to add studies, this is a much simpler process. And so on this, when the Chris Velos teams receives a clinical trial activation form, they will already, since we already said like the disease group is the division, so that's already kind of determined. But as the Velos CRIS team fills out that activation form, they will go ahead and fill out that CTSA All Flows Navigator study form for us, and they'll determine what the disease type is. And so in other words, as a clinical trial is being activated, that form to add the study to the mobile app is part of the workflow now. So as we see here, the Velos CRIS team enters it. They determine what the disease group type and are and fill out the form. And then overnight, this is automatic. Studies that have the CTSA All Flows form filled out will be added to the app. And then actually when studies are the way studies are delisted from the app are just when they are determined as inactive, not enrolling within the CTMS management system. So this whole process is streamlined and automated in a very, very good way with the partnership from the Velos CRIS team on helping us out. So that is our future flow to add studies, and this is happening right now. So if you have any questions, we'll have our contact info, and you can reach out and kind of get more info, and we can tell you more about it. Okay, so I wanted to change pace here and share a demo of the Trial Finder app. We're going to look at the web-based version of it. Well, let me just make sure everyone can see that. Okay, so this is what the front end of the mobile app looks like. As you can see, we have two pathways, a public patient view and then also a healthcare professional view. We'll kind of quickly go over what the differences are. But let's look at the public patient view first. So you can see here, we have that tab, like what's new in research. I think right now this links to the Frontiers website, but this is just to show you that the menu has potential to kind of have more usage than just trying to find clinical trials. We can update with new events and opportunities. So let's go to find a clinical trials. You can see we've kind of categorized them by treatment, prevention, and quality of life. You can even find trial by location, as you can see here. But why don't we go into treatment trials? And so here we can show you the directory. As you can see, find trial by disease type, which actually we've already know that this needs to be changed to disease group. And so why don't we go into cardiovascular, as you can see. So this is the disease working group. This is the divisions. And we click into cardiovascular, and you'll see all the different disease types we've determined from the trials that are in existence. So in other words, if a trial comes about and we haven't added that disease type to the form yet to be available here, the CRIS team will add it. So as we get new studies, we'll continuously add new disease types. Obviously, we can't think ahead and just capture all disease types available. So we kind of did this reactive way on adding disease types. So why don't we click on one here? How about COVID? And so as you can see, it lists the title of the study, a short description of it. And then again, remember, we're in the patient public view. So when we click on the study, there's even more information, keywords, the principal investigator, duration, the location. And what's nice here is the app, it actually connects to REDCap forms, secure REDCap forms, so that, if a community person who's viewing this wants to request an appointment, this actually brings up, yep, there you go. There is the REDCap survey. So I won't go into this, but it will ask for the patient's information so that we can reach back out to them to hopefully schedule an appointment. And then it's request more information is just it's a different REDCap form looking for more information there. So that's kind of nice that it's very intuitive and it's conveniently able to reach out to our study teams to request for more information if you're a patient or public community member. So why don't we go back now and check out the healthcare professional view. Oh, and actually, you know what? I forgot to show you one thing. There is a find trial by keywords, and we do feel like a lot of the potential participants will be using this one mostly. So why don't we just try like asthma? Okay, there we go. So here are all the asthma trials available that are on the app. So let's click into one. As you can see here, um, does the same thing for it shows all the locations, the investigator. So it's just nice to be able to search by, as you can see here, COVID. Here's a bunch of COVID trials. Try COPD. So, and we feel like the keyword search is important because a lot of potential participants, they aren't going to, know how to navigate this directory. This is kind of more for someone who's familiar or like maybe a clinician. So, and speaking of that, why don't we go to the healthcare professional view now? So you see there's a little bit more options here. So it's still the same thing, find trial by disease working group, that goes to that directory. They can find by title, location, make a trial referral. I think that actually it links to the Frontiers phone number, but we can obviously connect people who aren't necessarily at KMC or maybe at a community partner clinic or a regional partner clinic. So that's why that button's there. And then also there's an email link to get help by trial help by email too. So a quick way to access or a quick way to contact Frontier staff to help connect them to the right trial. So why don't we take a look at this again? Nicotine and tobacco, 3 studies there. And yeah, so the healthcare provider side actually does have a link to clinicaltrials.gov page in case there's any information that wasn't on the app that the clinician was trying to find. Why don't we go back? And then also refer patient to study, just another, I believe it's a REDCap form. Yep. So this is the physician referral form. It'll have some different fields, but another secure way to refer patients quickly from the app. So. And that is our demo of the Trial Finder app. So again, it's still in a work in progress. We're still developing it, adding the retro studies and future ones. Let me go back to the PowerPoint. Okay, and so if you're interested in the data feed or the app, there's my contact info. What we really think is cool about the data feed is that It doesn't have to just be the mobile app is just one way to display what's in our data feed. So if people wanted to maybe have a website that connects to the data feed and displays only certain divisions or disease types, those things are possible. So if you're interested in connecting it, please reach out for more info. Just some future initiatives that we're looking at. So we want to incorporate AI to help with lay language. As you saw, some of those study descriptors are a bit long, and we know that a lot of community people, just need something that's a little bit more straightforward for them to understand. We want to obviously continue to improve the user interface and menu navigation. And then we do have plans to incorporate our clinical frontiers partners. So, for instance, Children's Mercy, University Health, and UMKC and St. Luke's. We're looking to also list their trials on this app. And obviously, they have different clinical trial management systems and processes. So those will definitely have to be more of a custom connection rather than what we're doing here. But all the work here definitely is helping guide and model our approach to our Frontiers partners. And so basically that is our Frontiers Trial Finder app in a nutshell. Hannah, I'll just take a quick break. Were there any questions, or if anyone wants to speak up on Zoom too, that'd be okay.
There's no questions in the chat currently. Oh, someone just had a question.
Okay.
Will this be listed on the PUKHS patient and visitors page?
So that's actually something. So remember how I said the data feed can be used, it can be displayed not just with the mobile app. We actually are talking to the UK, the health system or KU health system side communications group, as well as the KUMC school side communications group on how we can possibly incorporate these onto specific like department websites or the overall KUMC UKHS website as well. So yes, we are in those talks. And I guess to that point, what's really nice is because of the key to this project, I feel like, is the partnership with the Chris Velos team. Because they've incorporated building that data feed within their normal process of activating trials, we feel like that resource and that process really can be used or can connect to other groups and research teams too. So it doesn't just like Frontiers will probably always be the site and source of the work, but that doesn't mean like other groups can't use it as well. And again, all of this is a no cost. Everything we're going to talk about today is no cost. So, yeah, there's already talks on other groups using it for their own needs.
I think that's all. Thanks, Hanlon.
Okay. Okay, great. So now I'll move on to the accrual prediction app. Some of you may have seen this before, but what is it? It's web-based. You have to be on the KUMC network at the moment. I didn't add that to the slide there. And our why here is we want study teams to have a convenient way to monitor their activity as far as trial recruitment performances go. It can also provide an opportunity to adjust strategies based on how your recruitment performance is going at the time. And what's nice about it is there's a search menu, kind of like the keyword menu in the Trial Finder app, but you can evaluate current enrollment metrics at a variety of different levels. So you can look at a PI, just an individual PI, a whole division, or a keyword. So you can look at a disease type or group. I'll kind of demo that here in a second. And then as we've kind of shown this off to individual small teams, we've kind of got some feedback that maybe another why is that, well, hey, if maybe we can use this as a feasibility or some kind of historical look at how study teams have performed in the past. So it's kind of nice to be able to see, or that study teams can see how the same or similar disease groups have performed or are performing. So so I'll show you what this looks like. We're again going to export to my web browser.
Hanlon, there was a question.
Sure.
When will partner institutes have access to this app?
So they have access to the app now. They can download it and use it, but connecting and listing their trials are different. And I would say we're just not at a point yet where we can say specifics on timeline, just that we're in talks. And like I mentioned before, each partner we have, they really approach their clinical trial managements differently. And so we'll have to really customize and really figure out how to individualize each connection to our data feed so that they could be on the app. And then, like I said, they could use it in a variety of different ways too. So I hope that answers the question. Let me know if that does not. Okay, so I'm gonna zoom in just a tad. Did not mean to have that up already. Or here, Hannah, is this, could you verify for me? Is this readable or is it too small?
I can see it. It's a little small, but I
Okay.
can see.
Why don't we zoom in and I'll just kind of shift horizontally. So
That's
this
better.
is, okay, great. Here, let me see if I can hide this. Okay. And so, like I said, it's a web-based platform, the CTSA accrual prediction app. And so again, here it's just listing all the studies, and actually right now it's listing every study that's listed in the CTMS system right now. So in Chris Villas, there's 626 entries. Um, and that's a bit overwhelming, right? So why don't we, so again, this is the search bar. On the left-hand side here, you can change the amount of the visual of entries you see per page. I just like to see all of them at once and not have to switch pages. But why don't we pick on my pseudo boss, Dr. Statland, and take a look at some of his studies here. I'm going to shift to the right here just so you can kind of, so you can see here, we have the ID, study number, target area. These are all going to be non-cancer. Again, I guess I forgot to mention this, but there are cancer center versions of both the trial finder and this accrual prediction website, but we're just going to be looking at non-cancer ones. As the frontiers work and support, our goal was to expand from the cancer center apps to expand them out to the rest of the schools. So that's why you're only going to see non-cancer studies on this page. So so you see here division, title. Now these columns here, I'll do a little explanation. So we have our PR or sample size. That is basically the enrollment goal that the study's trying to get. And then the expected duration in months, just the expected duration of the enrollment or study. That's just the unit months. And then the study start date. I've already sent in a request to add a column right here that actually shows the study end date, and it'll just be a calculation of this expected duration and study start date. We thought it might be easier just to visually see, oh, January 19th, and then you don't have to, calculate in your own head, oh, 1 year, so this should be 1/19/2024 of the end date. So we thought that'd be a helpful column. How many have been enrolled so far? To this day. And then this estimated date is when the algorithm predicts when you're going to reach your enrollment goal. So the estimated date you're going to hit your enrollment target, which could be late or early. And then through the algorithm, you'll have a lower bound prediction and an upper bound prediction, and then just a probability percentage that you're going to be late. So let me show a couple examples here. So why don't we pick one that is, here's a good one. Well, sample size. Let me see if I can find a higher populated one. Okay, we'll just go with this one. So as you can see here, this study, right now they're only, well, yeah, let's do a different one because that only has two. Okay, well, here, let's try it this way. Okay, how about this one? So this study was trying to enroll 10 people over 434 days. This one has a day unit. And so the study start date was just this past October. They've enrolled zero so far. But so here we were gonna have, as since different studies use different units here, like I'm not even, that's 1 year and 100 days or so. So maybe like somewhere in 2026, the study's going to end. They've enrolled zero, so again, maybe a bad example, but it still has, according to the algorithm, even though it just started, it still has a 52% chance to reach its enrollment goal. So let's pick another one here where there actually has been enrollment. Okay, why don't we just pick this one that's completed? And so this one was looking for 10 enrollments over 24 months. And so that's 2 years. So it would have been October 2024. So far, they've enrolled 10. And they are, yeah, so they've already hit their goal and they're completed. So let's look at what's nice about this accrual prediction app. If you click on the study link here, you can see the backside of it and how the algorithm is working. And it gives you some charts to, in case you needed to report it, or maybe if you're doing a publication, you wanted to show some data on how this works. Okay, you know what? Let's let's find another study because these are not working. Why don't we switch it up? Dr. Statlin does a lot of rare diseases, so these are kind of hard to show off sometimes. So let me go to my other boss, Dr. Mario Castro. Okay, I think this might be a good one. So this one, they were looking to enroll 100 over 4 years. Study start date was this past June. They've already enrolled 17. And so their estimated date of enrollment completion will be September 27, which will be ahead of the 2028 date. Again, it'd be nice to have that, date of study enrollment completion or end date of enrollment. And as you can see, the algorithm says that the worst that they could do is, or the best that they could do is in December finish enrollment, and the worst they could do at this point would be November in 2028. And so right now they only have just above a 9% chance to be late in enrollment. So this study is doing very, very well. And when we click on here, so here it shows you the plottage of the plots of the algorithm. And so right now they're at this point. And so after these are months, so about the 5 month mark. And so after the current time period of 5 months, the algorithm starts to kick in. As you can see, there's an upper and lower bound. This is the prediction of when the enrollment will be completed. This red line is their target date to finish enrollment. So as you can see here, the the prediction enrollment is going to be before the red line. The lower bound or the upper bound is going to be under 30 months, and they have a small chance of being past the 48-month mark, which is why they only have a 9% chance of being late right now. Obviously, as time goes on and enrollments happen or don't happen, these plots will change. So just very interesting to see this backside. If you needed to show um, or visually display how your enrollment metrics are going. Um, that's a good way to, clicking on this link will be able to show you that. And so that is our CTSA accrual prediction application right now. These colors just kind of color code how well they're doing. So like things that are going to be very late are in red. Things that are looking good are in green. Yellow is kind of in the middle. So, but yeah, please feel free to reach out to us. We can put you know what? Why don't we put the link in the chat? And let me put, just in case anyone wants to, and we'll get the questions here in a second. Let me just make sure this is the last slide. Yep, this is the last slide. So Hannah, why don't we take a break now and answer any questions that may have come up over this one?
Mostly just questions about where to find the recording of this
Okay.
presentation. But then also just to clarify, I think the question earlier, they were talking about the accrual prediction application, not necessarily the other app.
Oh, right. Yeah. So, okay, apologies. So yeah, this one is actually right now just KMC only. We haven't started talks yet on how to replicate this for the partners, but since this app and the Trial Finder app work similarly in talking to the institution's clinical trial management system. I believe when those talks are happening, being able to pull this out and display partners studies will be also in those talks. Now, obviously, I don't know. We're talking a little bit ahead and maybe over my pay grade, but I don't think we'll be able to mix them together. The algorithm will be able to be replicated at each site. So it might be a thing where KUMC people can only see KUMC, Children's can only see Children's with the algorithm, or UMKC can only see UMKC and St. Luke. So what have you. But again, those are early talks. So we'll just keep working with our partners on that. And if you have any suggestions or ideas as far as connecting with our partners, please feel free to send us a message on that as well. Okay, cool. Let me go back to the slides. Hey, great to see that, Jesse. Okay. Okay, so the second half of our session here will be about the Trial Innovation Network. Again, some of you may have heard of this before, But so the Trial Innovation Network is a collaborative initiative within the CTSA program, and it's composed of three parts. So all the CTSA program hubs, which there are over 60 now, and that's just the main hubs. It doesn't include the affiliates. So like Frontiers just counts as one. We don't count as 6 or 7, hubs. And then the two other parts of the network are the Trial Innovation Centers, which are made of Johns Hopkins and Vanderbilt, and then the Recruitment Innovation Center, which is also ran by Vanderbilt. Now, these innovation centers, let me switch slides here. It'll kind of give you a better idea visually. So this is a tree of just how the network is made up. As you can see, NCATS, the National Center for Advancing Translational Science, which kind of houses the CTSA program. And within the CTSA program, we have the Trial Innovation Network. And again, here we have the 60 plus hubs. And then the innovation centers, which the Trial Innovation Centers, or the TICs, there's 2 of them who collaborate together, Vanderbilt and Johns Hopkins. And then the RIC is also ran by Vanderbilt. Now, for the TICs, the Trial Innovation Centers, Vanderbilt, they mainly focus on helping with study design and the startup teams. And then Johns Hopkins, they basically execute any of the consultations provided, which we'll talk about in a second. And then they kind of specialize in operationalizing single IRB and standard agreements for multi-site trials. So that's how Vanderbilt and Johns Hopkins work together in tandem on that. And as far as the RIC goes, Vanderbilt, their kind of tagline for this is just to provide tailored support and advice for trial recruitment and retention methods, including best tools and strategies. So I'll kind of go over how some opportunities and resources that we can utilize from this Trial Innovation Network here. Okay, so the first resource or tool I want to talk about is researchmatch.org. It is a website, a public website. It is ran by Vanderbilt. What is it? Yeah, so it's Vanderbilt developed as a RIC tool. So part of their being a RIC, it's part of their RIC program. This is just one of the many tools they have available that we just wanted to highlight here. And so it's a website that match makes interested participant profiles with research studies. And so the way it works is just continuously people are making profiles, and then as a researcher wants to post their studies, it will tap into that current pool of interested participants, or that registry of interested participants. So I know research teams, they'll maybe send out a message, every 6 months or so, because in case there might be new profiles, and we'll kind of show you how that works too. Right now, we are putting it, oh, apologies there. We're actually putting a lot of efforts. So we learned that our KUMC agreement with researchmatch.org does not act as an umbrella for our partners. So each of our Frontiers partners will individually need to sign their own agreement with researchmatch.org. And so we've been diligently working on that this past summer. So we did recently get KU Lawrence on board in August. And so it's been very nice. We're onboarding them, working with their comms team on how we can promote it internally at the Lawrence campus and also in their community to try to get people to create profiles. And just some quick strengths and weaknesses. So um, I will say that our profile counts in our area, in our 50-mile radius of KUMC or the KCMO area, the profile count's pretty low compared to some higher populated states, which is expected. And so we've kind of seen that for our use here, and that doesn't mean you can't get people that you won't connect with people for in-person studies, but if your study is remote or like telehealth by Zoom or from an app on your phone or surveys, you're tapping into you can tap into the national registry with those kind of studies. For in-person, if they need to come to the clinic or lab, there's a bit of a lower count, so it's more challenging and harder to really use it in that sense. And then in this third cycle of Frontiers, which has only been a couple years, we're trying to do more community promotion within our local events. So we're trying to get our local profile counts up. So I just wanted to plug that because if your team or your group or your community group has, like a 5K, some kind of community event, kind of related to health, let us know. We would love to try to get out there and just try to bring awareness to researchmatch.org, especially in the local community where there could be potential participants who are interested. So let us know about that. Okay, so just an overview of how it's very simple to use as far as the researcher side. So you'll create a researcher profile, and that does not just mean PIs. Managers can do it, coordinators can do it. We've had recruitment managers, not the PIs, create profiles and post studies and send out messages to potential participants. So it's not just PIs who can create profiles. Um, to post your study, the only documentation you'll need is the latest IRB approval letter. And then excuse me, when studies are active on researchmatch.org, they're only active 1 year from the approval letter expiration date. If it's an indefinite study, they'll be active for 1 year from when the study was submitted onto researchmatch.org. And I'm the liaison for us as far as KUMC and all of Frontier's partners. And so when people create profiles or try to request to post their study, I'm the person who checks that all the documents are right, and I'll push the green button for any of these activities to become active. So and then within the researcher side of researchmatch.org, there's actually some feasibility tools. So even if you didn't want to post a study or weren't ready for it yet, I really do feel like it's still worth your time to create a profile and go onto your researcher dashboard and just mess around with some of the tools there. And you can kind of search the current registry and just kind of do some feasibility look aheads. There's also some monthly research training webinars that happen every month. So they're live, you can join those and you can ask questions and kind of give more insight on how to use some of the tools. And we'll go over some of those in a second here. I'll give you an insight to what the website looks like. And they had this diagram I thought was really well on how researchmatch.org works. As you can see, sign up is free. The research side, you register your IRB approved study, you can search, and then you can send them a message, and then you match. As far as the volunteer side, you create a profile, and people who create participant profiles can give as much medical information as they want. For example, I have a profile made. I strictly just keep it as a healthy participant so I can kind of see how that flows. I really haven't added my own medical information yet. And so that's just one way you can go about it. And then you just wait for emails, and I'll give more anecdotal evidence from my own end. I get maybe 2 to 4 emails a month, kind of for male general healthy surveys and remote studies usually. And then so there will be on this right side is an example of the message participants get. Researchmatch.org will help you create this if you need help. But as you can see, it's just a study summary that is create, and the study team creates all the language here, and except maybe down here. So then on the email, you just say yes, I'm interested, or no, thanks, as a participant. If you say yes, then the research team will get your contact info, and then it's up to that research team to actually reach out to you and give the participant more info and how they could maybe consent for it. So this is not a consenting process. It's just a matchmaking process. Um, and yeah, again, the volunteer has control over the release of their contact info. So I thought this was a good diagram on overview of how researchmatch.org works. Okay, so let me quickly go to the website or my website tab again to show you researchmatch.org. So this is their home website. Let me zoom in a little bit. Don't look at my password. Okay, so this is my liaison dashboard. I'm the only one that has this. I'll just quickly show you this. This is some insight into the metrics. So volunteers within 50 miles, that is KUMC on Rainbow. We have 337, 63 active researchers, 1 active study. On the right side, institutional metrics, you can see how many total researchers and studies we've had, how many volunteers have been contacted, how many have actually hit that yes, I'm interested button. We've actually only had 1 enroll, so hopefully we can do a better job of promoting it within the community, and then we'll get more researchers to use it, and that number will go up. So that is my liaison dashboard. Let me go to the researcher side. This is what you all will see if you make a profile. I will quickly go through this as we're running out of time. But here is a feasibility search. You can go here. What kind of research do you want to run? So if you were ready to start sending your message and you posted your study, you'd say recruitment, select your study, and then you'd go about it. But we're just going to do the feasibility. We want to do English. Does your study probably focus on parenting and pregnancy? I'm gonna leave this blank because I want both. Oh, right, but I have to because, okay. So you could, right now, as you can see, with the filters we have applied now, which is just English language, and we haven't selected this, we basically have the entire registry count, which is about 120,000. So why don't we say I'm not focusing on parenting or pregnancy? Let's go by location filter. Why don't we just do state of Kansas and Missouri? Demographic filters, as you can see, these are all the different demographics you can do. I just want smoking and maybe, how about 40 to 70? And then health condition filters. So here you would just search for it. So I'm going to pick diabetes. As you can see, they kind of suggest things. I'm going to pick one, very broad one. When I add it, give it a second. It'll show you all the possible disease or diabetes within their profiles. So you can go through and maybe get a little more specific. I'm just going to hit the select all button because we're running out of time. As you can see, it lists all the summaries there. You can even do medication filters. I don't know what medication diabetes patients use, so I'm going to leave this blank. Or you could see volunteers with no reported medications. We'll just leave that blank though. And so as you can see, through those filters, and it summarizes the filters we did. State of Kansas and Missouri, ages 40 to 70, tobacco use, yes, parent, no. And then we did any type of diabetes. As you can see, we have 30 people within the state of Missouri and Kansas within this participant registry. And you can see here, it kind of gives you some nice percentages. So you removed, if we just did the state of Kansas and Missouri, we removed almost 97% of the whole registry. These demographics removed 87, the health condition. So as you can see, kind of interesting to see how that goes. And so that is the feasibility dashboard. I encourage you all to kind of play with it. What's really cool here, there's a volunteer perspective link. I think this is really cool. So it'll load here. Yeah. So here's some examples. So like feeling of sadness is just a disease or condition, and it'll give you metrics on that. So what's the common medications within our registry for people who have reported feeling of sadness? It gives you the percentages of the medications, coexisting conditions, age distribution, BMI distribution, some demographics up here. Very interesting. What's even cooler, though, is this link here. This link actually shows you written testimonies from participants and their suggestions and ideas for research in the feeling of sadness category. So I would like to see the length of medication. For almost 20 years, I've had terminal cancer. When I was 13, I discovered a lump of my testicle. So as you can see, I found psychotherapy very helpful. Looks like someone or two people did that together. And it gives you demographics of these testimonials too. So I mean, I just think this is really interesting, and I think others will find it as well. Let's just look at one more real quick. High blood pressure. Oh, in here, just real quick, you can also search. So our diabetes, I won't get into it, but you can do like we did before and search for it. But as you can see here, there's metrics, the medications, coexisting conditions, BMI, age, and then let's go to the research ideas. Again, just a lot here. So yeah. So very interesting stuff, and that is. Let's go back. And then just real quick, you can see the studies you have listed. This is my liaison example that I can use for testing. There's information here about the monthly webinars and then actually tutorials with videos and a PDF. I've looked through all these, are very helpful to just be more specific on how to use this. You can see my contact as the liaison. Hey, look, we've had in the 120,000 registries since we last visited, 5 people nationally have been added. So you can kind of see that insight. Okay, let me go back to the slides. I think we have a break here. Okay, yeah, so any questions on researchmatch.org or ones from the apps we previously talked about?
There's a couple questions.
Okay.
First one is regarding the language that for the study posts on researchmatch.org. Do those have to have KUMC IRB approval?
Yes, yes, I believe you do. Yeah. So yeah, that just like any way you provide study messaging or marketing, it does have to be IRB approved. So yes.
Okay. And then another question was, is there a demographic filter to look for parents of children or parents and caregivers of those with intellectual disabilities?
I don't believe so, but Hannah, can you repeat that? And I would love to forward that to the researchmatch.org team. That was a researchmatch.org question, right?
Yes, yep. So they're looking for a demographic
Oh,
filter.
You know what? It's in the chat, right? I can look it up
Yes,
later. Okay, I will forward that because that is a very specific but great ask there. So, and you know what? Here's the thing: they might have that metric in the back end that we can't see, so it would never help to ask. So,
sure. And then another question, how are people at KUMC being encouraged to register on researchmatch.org?
as far as users like science teams and research teams, just through like this webinar and us trying to get word of mouth and trying to get people to use it more. So like me showing off the feasibility tools, hopefully that attracts people to use it. Now, as far as the community of KUMC, like I said, we feel like our direction should be if we can show effort into increasing our local participant profile counts, that will just even encourage our research staff to use researchmatch.org even more. So like I said, to increase the profile counts, we're trying to go do some boots on the ground marketing at health events and conferences and symposiums, and then hopefully again we can kind of translate that and show, hey, our local account is getting bigger. This tool could be more useful now. And so, yeah, it's just through webinars, emails, dissemination. We'll try to do like the monthly personnel, research personnel meetings, things like that. So if you have any suggestions on how we can get the word out to disseminate, let us know.
I agree. And then also to add on to that, if there's any events like either in Kansas City or Wichita, Hanlon and I can attend those. And we both have flyers and things like that to
Yeah.
spread the word about Research Match as well. And then last question is Research Match better or different than clinicaltrials.org?
They're actually not similar at all. So clinicaltrials.org is more like it's just a listing of all clinical trials. As you know, every trial needs to be registered in the US at clinicaltrials.org. Whereas Research Match is just a matchmaking platform. It's not a database for active trials. I don't even know I think participants can search for studies, but like it doesn't have all existing trials. So they're very different. One is a database of all existing trials. One is just trying to match interested participants with the studies.
And then there was another question, what steps would Children's Mercy need to take to get
Yeah.
their studies on
So
Research
yeah,
Match?
Abby, as I was saying, actually, I think Children's and St. Luke's and UMKC we're already talking to get them to sign an agreement. So I guess to get your studies added, we would have to get Children's to agree to become a part of the researchmatch.org program, which would mean there would have to be a contract signed. And since we've already done that with KU Lawrence just recently, we kind of know how it works. So I think it'll make it easier to do it with Children's. And actually, Abby, we'll probably have to work with you and Dr. Mark Hoffman and the informatics team to go about this. So maybe we can talk about it here in the near future and get some steps going.
Yeah, I'd love to talk about it. I just wasn't sure if there's been
Yeah.
conversations already happening here or not.
Yeah, we definitely have. So,
Cool.
And I
okay,
think that's
cool.
it.
Are we good to move on? I know we're getting there, and I just quickly want to go through the last ones here. Where are we on time? Okay, so I can do this real quick. Okay, so within the tin as well, there's some multi-site trial resources. The first one is the expressions of interest, or we call them EOI. So what this is, it's an announcement that a 10 multi-site study is looking to add sites. So these studies can already be funded or they're in application in progress. And to submit an interest, we'll need to identify a local site PI. So this doesn't have the same restrictions. This is active at all Frontiers partners, KUMC, Children's, UMKC, St. Luke's. We've actually gotten some site PIs at all 4 sites to apply for an interest at least once. So that's good news. So yeah, but anyways, we'll have to find a local investigator who can serve as a site PI. There could be facility and equipment requirements, and there's also some clinical requirements too, like maybe a specialist. And I just want to highlight or make a point that if you ever come across these EOIs, they're just an expression of interest, just literally as it says. It's okay to withdraw later anytime if we no longer want to pursue it for whatever reason. But these are not you're joining the study or formally making an agreement. It's just to show I'm interested in being a site. And then conversely, if you're starting your own multi-site trial, we can use this process and program to recruit sites to your own multi-site trial study if you need it. And I was going to demo the REDCap surveys. You know what? Let's just do it real quick. because I want to show just how easy it is. So there's usually 4 things to fill out. They're not always required. The first one is an interested PI survey. And then, so here's an example of that. It's just very simple. Would you like your site to be considered? If yes or no, any comments? Have you found any other multiple investigators? No. So let's go to the next one here. So for protocol, what's nice about these forms is even if you don't want to participate, you have a chance to give feedback on the study. So if you read the protocol, but you know you can't be part of the study for whatever reason, but you still want to give the PI some feedback, you have opportunity to do that. So in the protocol synopsis, there's chance to have give feedback on concerns of study design, study endpoints, things like that, protocol feasibility, and then same thing with the budget. It's not just a hey, is the budget okay with your site? You actually have a chance to give feedback too. So underfunded for your expenses, they want to learn. Hey, if you can't join the study because of budget, why? Is there something we can help to make it more accessible for other sites? So you see, these red cap forms are very short. The hard thing about these is sometimes there'll be an EHR assessment required, which means we'll have to work with informatics team to get some EHR feasibility and counts just to see if the study's feasible at their site. So I know I went through that quickly. Let me go back to the slides. Okay, so moving on to the multi-site consultations. So if you're developing a multi-site center proposal or study, you can submit it to the TIN and you can get national experts to give you advice on any aspect of your proposal, from like protocol, recruitment, retention, to budget, to any area of the proposal. And so good candidates for this would be, it'd have to be a clinical research study. You don't need to have funding already, but you at least have to have potential funding in mind. It helps. What's super nice is that there's no restrictions on source funding, so it does not have to be federally funded. Now, our definition of multi-site, only studies that are 3 or more sites can use this. That's one stipulation, or kind of the main stipulation. And then the TIN consultation process, they want to connect with you as early as possible. So let's just say you have a pilot study and you're thinking about translating it to a multi-center study. They want to connect with you there and start the conversation if you need that help, obviously. But that's how early on they would like to connect with users. I'm just going to quickly, so this is a timeline of how the consult works. You submit your study, they'll contact you within 5 days. There'll be an initial consultation within 30 days. Within that initial consultation, we'll kind of decide what resources or what help the investigator or study team needs from the consultation. So it could just be already, hey, there's resources that we can make available to you, which I'll list here in a second, some summary recommendations, and then if it's early enough, like a pre-application project, you can get a full, complete, comprehensive consultation where they'll help you develop the study all the way. Now, usually they prefer that to be about 180 days out. That's very soft. I know they've done complete consultations within like 60 days. So that's just a recommendation. So from the consultation, these are the various different resources through the TIN that Johns Hopkins and Vanderbilt have developed as the RICs and TICs. And so these are the categories of resources available. So study planning, SIRB support, standard agreements, recruitment and retention plan, feasibility, recruitment materials, community engagement studio work, if you need help with doing EHR-based cohort assessment, and the expression of interest if you wanted to recruit other sites to join your study. And then innovative trial design is just, almost like study planning. So, but that was listed there. But these are the kind of resources that could be made available to you from the consultations. Okay, so I know I went through that quickly. Those last 2, please reach out if you have any questions on the expression of interest or multi-site consultations. I just wanted to overview what we went over: the Trial Finder app, Accrual Prediction app, researchmatch.org, and then the 10 resources. And that is it. So thank you all so much. I guess we'll end it with any questions
No more
at the end.
questions.
Okay, no more? Okay. Well then, thank you all very much. Have a good day, and thanks for your time.
Thank you.
Thanks, Hannah.